Can we have a huge round of applause for the official inauguration of National HealthTech Innovation Conclave, presented by Iron Mountain and powered by Schneider Electric. I'd also like to thank all our partners, powered by presenting partner Iron Mountain, powered by partner Schneider, gold partners Cloudforce, Shri Weddington, associate partner Trimit, NGO partner Winning Happiness, and supporting partners National Health Authority, Heights and HSCC, and the country partner Embassy of Sweden as well. So without taking much time, I would like to invite Dr. Basant Garg, IAS Additional Chief Executive Officer, National Health Authority, to give a special address on Ayushman Bharat Digital Mission, making healthcare accessible the digital way. Over to you, sir.
Respected dignitaries on the dais, dear friends, a very good morning to all of you. I'm really privileged to be here amongst you and speak on the Ayushman Bharat Digital Mission and how it aims to revolutionize health sector by leveraging technology. The mission was launched in September 2021 with a vision to change the way how all citizens they interact with the health ecosystem and the way health transactions take place. Given the size of our population, it is important that we shift to a digital way of doing health. Our experience with already existing digital public goods, such as Aadhaar, has been an eye-opener for all of us. It has also given the nation a lot of confidence that we can and we will adopt latest technology, latest methods. As we speak today, 1.3 billion Indians already have Aadhaar and close to 100 billion Aadhaar-enabled transactions have taken place. During the pandemic, we saw how COVID helped us save lives and how we were able to administer close to 2 billion vaccine doses. It was a gigantic task, and technology made it possible that it was seamless without any VIP culture, and every citizen waited in turn with the belief that they will get the vaccine, and they got it. Similarly, taking a cue from this, the government has launched the Ayushman Bharat Digital Mission. National Health Authority under the Ministry of Health and Family Welfare has been entrusted with the task of creating digital public goods. Just as there are authorities which create physical infrastructure, we are creating digital infrastructure. The Ayushman Bharat Health Account, a unique health ID for all citizens. The Healthcare Professionals Registry, a unique ID for all healthcare professionals such as doctors, nurses, and practitioners of Indian system of medicine. And the Healthcare Facilities Registry, the HFR, for all health facilities such as hospitals, laboratories, pharmacies. These are the three building blocks, basic building blocks of the mission. In addition, built over these three registries, we are also creating digital public goods such as the Unified Health Interface, the National Health Claims Exchange, and the Health Information Exchange Consent Manager. So let me speak a bit about ABHA, the Ayushman Bharat Health Account. For all 1.4 billion Indians, there is to be a unique health ID. So all 140 crore Indians will have a ABHA ID. As of today, 43 crore ABHA has already been created and people are using and linking their health records to their ABHA ID. What does ABHA enable? ABHA enables a citizen to link his health records. Now, your health records today may be lying in a public hospital such as AIIMS, PGI, or your health records could be lying in various private hospitals or small clinics. The record stays there, but when you need it, you have to go and get a physical copy, which you try to preserve and show to your next doctor wherever you are consulting. Now, try to look at it from a digital perspective. If all the hospitals, they are interoperable on a network and they identify you with a unique health ID, then the record available in that hospital can be linked to your ID and can be made available to you on your handheld device, which is the personal health record app. And instead of carrying a physical copy, you can then carry a digital copy and take it around with you. And only with your consent, you are able to share it to your physician. So that is the construct of the Health Information Exchange Consent Manager, and it is based on ABHA. Now imagine the kind of efficiency this introduces in the system, wherein you don't need to carry any physical record. It improves clinical decision making by the doctor. It reduces repetitive testing because you are carrying the test reports, especially for people who come from outside Delhi, from outside, far off areas like the Northeast. They need not carry those reports and they won't be asked for repetitive test reports. Imagine how easy it would be for parents when they are asked about the immunization history of their child by the school. And if the history is already available on their PHR app, so there will be better record keeping of all immunization record. Imagine a generation wherein nobody has any physical record and every record, health record of an individual is available right from his birth. So at any stage of employment, government recruitment, education, any stage of foreign travel, the record is easily available. For insurance, for health insurance, the record is available. For applying for a driving license, all records are available. What kind of efficiency and prevention of falsehood, fraud, this would introduce into the system? The second important thing that I want to talk about is the National Health Claims Exchange. Today, a hospital, it uploads all the claims for health insurance, and then there is a large wait time. There is a lot of to and fro of any health claim, leading to larger cost of claim settlement, more time the claim takes. And in fact, even on the day a patient is told that he will be discharged, his discharge is held up for close to 9 to 10 hours. I think all of us must have experienced. We are told by the doctor that you will be discharged at 9 in the morning, and by the time actually a patient is discharged, it takes maybe 5 or 6 in the evening. That's because the claims, the clearance from the insurance company never comes, or it takes some time. Now imagine a situation where a hospital, as soon as it lodges a health claim, the claim is automatically processed by a machine, because the claim is machine readable, because the doctor is verifiable, the patient is verifiable, the procedure and the standard treatment guidelines are known. Now, because of all this, the claim is settled in real time and the hospital gets its money in time. The kind of efficiency it brings to the system, the reduction in cost, and it will increase bed availability. Because a patient who is set for discharge at 9 in the morning, he will be discharged at 9 in the morning. So there is it was estimated in a study that such a system would introduce 8% more hospital bed availability. So that is the kind of efficiency which a claims exchange or a machine adjudicated system can bring to the health ecosystem. And now I'd like to talk about the unified health interface that again the National Health Authority is developing. Today, for you to teleconsult or to book an appointment with a doctor, the patient and the doctor have to be on the same platform, using the same application. Just as it was in the case of finance before UPI came, in health, we are aiming to build interoperable services wherein a patient on one health application can teleconsult or book an appointment with a doctor on another application. This would increase discoverability of services. It will lead to better market pricing of services, lead to better access, and we can build on not just medical services, we can build on services such as ambulance, blood banks, all on the UHI. At NHA, presently, the UHI has been developed and it is under testing with active partners, both private and public. And we are hopeful that we'll be able to formally launch it very soon. The National Health Claims Exchange is again developed and it is in our sandbox environment. Many insurance companies have joined our environment and they are presently testing it. And the Health Information Exchange Consent Manager is already fully operational. People have created their ABHA, people have downloaded the PHR apps and they are able to store their records, see their records on those apps. Other than this, these are the basic public goods that the mission aims to create. Then built on these public goods, there would be services. Let me also tell you about our high-speed OPD registration service, which is known by the name of Scan and Share. It was launched in December in Lady Hardinge Medical College in Delhi, and today 1,700 hospitals across 32 states, they are using the services. Every day, close to 75,000 patients, they use this service. What is the service? All of us know that in large, very popular hospitals, public hospitals such as AIIMS, PGI, all the big hospitals, there are queues in the morning. People stand in the queue just to get an OPD registration done. The counter may open at 8 o'clock in the morning, but the people queue up, they start queuing up at 6 o'clock, and even by the time the counter is closed, many people don't get their turn. The data entry which happens at the OPD registration counter is full of errors because the clerk sitting there, the operator sitting there is under pressure. Now the whole service was reimagined and the Scan and Share was introduced. It is a QR code based service wherein using your PHR app and your ABHA ID, you can send your demographic information, your name, your address, your Aadhaar, your age and sex, all the demographic information you can send to the OPD clerk, OPD counter within seconds. And you only need to visit the OPD counter just to generate the OPD slip, which tells the specialty. Of course, going ahead, we will also develop systems wherein even this can be entered by the citizen himself, wherein the specialty can also be entered by the citizen and he can go ahead and visit the doctor using a digital OPD slip. But today, we estimated that the average time spent by a citizen in the queue has decreased from 50 minutes using this digital OPD registration system to about 4 minutes. So imagine the amount of time that has saved and the way it has simplified the patient's journey in a public hospital. It is not just public hospital, the service is available free of charge to all private hospitals as well. But I think the most impact that it has made has been in public hospitals. At the National Health Authority, we are committed to and we are working to develop more and more use cases for the digital mission in order to simplify everybody's, every patient's journey. But let me tell one thing. There are always, there's always a critical mass. Like Aadhaar also needed about, 80 crore, 90 crore Aadhars nationally to reach a critical mass wherein Aadhaar became a basis for so many services. I think for ABHA, we are at 43 crore. We would like to hit around 100 crore. By the time we can say, ABHA will be more popularly used and more services will be built on ABHA. And for that, we are building in inclusivity also, because 100 crore people don't have mobile phones. So we are trying to build in ways in which people who don't have a smartphone, people who don't even have a feature phone, they are also made part of the digital way of health. I like to end on this note that the National Health Authority is committed to delivering on the various aspects of the digital mission, but it is not just the government which has to come up with this. We are just creating the basic infrastructure. We invite and we hope that the private sector, the innovators, the startups, they join the National Health Authority, they join the ABDM to create, to innovate and to improvise and give better services built over ABDM. Thank you.
Thank you so much, Dr. Basant Garg, Additional CEO of National Health Authority. And as you rightly said, we all have experienced the path-breaking work being done by National Health Authority. You talked about the Abhan and digitization records and other things. Also, we can give the example of COVID, how it was a game-changing, and you talked about the inclusive approach to healthcare. We saw how even a person who doesn't have a smartphone, he used his smartphone to get the vaccination done through COVID. And if I'm not wrong, that COVID has also extended help to other countries as well. So that's the game-changing thing being done by National Health Authority.